Hi, Curtis here. Today I'm both Revolutions in Fitness physical therapist and patient at the same time. I've been lucky enough to have a frozen shoulder on my left side. The great news is with treatment it's gotten a lot better. And one of the things I found that's really helped it out, surprising to me, the research around frozen shoulder and shockwave, also known as acoustic compression therapy, is quite robust. Basically, there's a big water tank over there. That water tank is sending water through that hose, and as you'll hear in a minute, that water is going to be bouncing off of that sound head, and then that sends a sound wave or pressure into those tissues. And it helps break up some of the adhesions and loosen up some of the tightnesses that are associated with frozen shoulder. There's an old trauma here that I won't go into. So check out the research below. You'll see it in the links below, but there's a fair bit there. So we're going to do a live on this, meaning I have not yet treated it yet today. And so my right shoulder does this and my left shoulder does that. And when I get to that place right there, I get some discomfort in the top of my shoulder and the outside. And my right shoulder does this and my left shoulder does ouch, and that hurts also back there. So we're going to spend, go for it. We're going to spend just a minute and a half or here working on, and you hear that click, 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 click. That's the shockwave sending, or that's the unit sending pulse waves. And the good news and the unpleasant thing with this is you know when you're on the right spot as a patient. And so go ahead and bump up the intensity just a little bit. And so what she'll do is she'll find a location and an intensity that's a little, it's a little uncomfortable, honestly. And you know you're in the right location. A little more intensity. And as a therapist, she would be asking me these questions right now as opposed to me directing it. A little more lateral, a little more up, yeah, and so perfect. She would already know where to work, having evaluated my shoulder, and know, yeah, that's it, and maybe just a little bit more intensity. I'm looking for an intensity of discomfort that's not a 2 or a 3, but an intensity that's somewhere between a 4 and a 6, or maybe even a 5 and a 7. And I'm covering it up right now, but that's uncomfortable in a good way. It feels like we're doing some work. And then so you can do shockwave passively, which is what we're doing now, or I can also add a little bit of motion into that, and that's just working those tissues, moving those muscles over top of that ultrasound shockwave. And yeah, that's a little bit unpleasant in a really good way. I know I'm working on something that's important right here. And so we usually do 2 to maybe 4 different locations, important locations, and then we recheck after that. And the good news is you usually have a pretty immediate feedback loop of whether this is going to work or not. 1 to maybe at most 3 visits, and you start to see some, even some pretty significant changes in range of motion, whether that be in a shoulder, or right now we're getting some really great effectiveness with there we go, let's see, 1 more there, with tendinosis, hamstring tendinosis, high hamstring strains, lateral epicondylitis, a la tennis elbow or golfer's elbow, or in this case working on a rotator cuff and a frozen shoulder. So yeah, we'll find out in a minute what this has done. Usually we'll work on it for 3 to maybe 5 minutes. Today we're going to catch this for maybe 2 or 3 as you're seeing, and then see what happens. That's just getting a lot easier for me to move, and it probably is going to make a nice difference in my shoulder range. Okay, go ahead and pause it there. And then, and so a moment ago I think I was about here, and that was my truth. Hey, and now I'm about there, and that makes me smile. A moment ago I was there, and that was my truth with pain, and now I'm about there, and that makes me smile. Yeah, that's just a lot easier. What's usually also cool is when mobility improves in tissues, in this case adhesed tissues, improve their flexibility. Also usually strength changes. We didn't pre-post test strength, but my rotator cuff is now engaging a lot better than what it did before. So stop in, check out our Shockwave. Our first one's actually free, totally free, and we can do that just outside of a physical therapy visit, or we usually do it inside of a physical therapy visit. And it might just make a difference for your knee or back or Achilles issues.